Hi, I'm Dr. Dave, and welcome to Taking Care of Your Pet. In the last installment, we talked about the basic pathophysiology of canine parvo. This week, we'll talk about caring for dogs suffering from the illness. And next week, we'll talk about vaccines and prevention of this common canine disease. At our clinic, when we get a call about a puppy that's lethargic, has diarrhea, is vomiting, and has an unknown or incomplete vaccine history, we treat that puppy as if it has parvovirus until proven otherwise. The two main reasons for this are the disease is highly infectious and contagious, and to protect other patients, everything the puppy touches is either discarded or cleaned thoroughly with a bleach solution. The other reason is the illness can kill so quickly. If we don't test the dog, or if funds are not available to test the dog, we immediately begin treatment with fluids and antibiotics. There is no cure for the disease. All we can do is provide symptomatic and supportive treatment and do our best to help the puppy fight the illness on their own. If you notice these symptoms in your dog, vomiting, diarrhea, lethargy, and you're unsure of the animal's vaccine history, contact your veterinarian immediately. Depending on the funds available, the treatments can be relatively simple or very, very involved. The primary killers of dogs suffering from a parvoviral infection are dehydration and infection. Of these two, dehydration is our bigger concern. Your veterinarian will administer fluids, either subcutaneously, which is a needle under the skin, intravenously, or in very small dogs by placing a needle into the end of a bone. Your vet will also administer antibiotics, anti-vomiting medications, and sometimes pain medicine. In some cases, if resources allow, if it's warranted, and if the owner desires, whole blood or plasma transfusions may be given. There is no definitive protocol for treating parvoviral infections. You may hear different advice from different veterinarians, but all vets will do their very best to work within your budget to help you save your dog. The intent of this installment is not to provide a detailed step-by-step regimen for treating your dog or to critique the various means different veterinarians may use to treat your dog. I want to familiarize you with the basics of therapy and to emphasize that if the possibility of parvovirus exists, speed and decisiveness are extremely important if you want your dog to have a chance of survival. The disease can kill in a couple of days. Your dog may or may not survive without treatment, may or may not survive with treatment. But if you want to avoid the grief of a lost pet, do not spend time searching online for reasons not to take your pet in for care. And do not be talked out of a veterinary visit. You do so at the risk of your dog's life. As vets, we see cases like this all the time, and watching these animals deal with a parvoviral infection is almost as devastating to us as it is to you. Help us help your dogs by getting them to us quickly so we can work with you to prioritize what should be done with the funds you have available. Next time we'll wrap up our discussion of this illness by reviewing prevention, vaccines, and the aftermath of an infection. I'm Dr. Dave, and thanks for taking care of your pet.